So this is just going to be a short screencast to go over the presentations that I've had up over the last sort of week or so. So the main aims are to have a look over what muscle strength and endurance is and what that means, considering the basic components of the strengthening and endurance program, how to manipulate basic components of a program to develop muscle strength and muscle endurance, consider the potential physiological and psychological benefits of strength training, and then consider and practice common progressive overload techniques. So there's lots of literature out there that you can use to be able to support your argument in relation to exercise, and it's important to consider the patient group that you're designing a program for. So looking at the difference between endurance and strength. So endurance was shown to be defined as the ability of the muscle to maintain isometric contractions or continuous dynamic contraction. Strength is defined as the maximal amount of force exerted during a single maximal effort. Now, it's important that you understand the difference between endurance and strength and what you're trying to achieve as the main goal for the patient. And it's worth bearing in mind that improving muscle strength will generally increase muscular endurance. However, improving muscle endurance does not improve muscle strength. So the next few slides talk about the 1 rep max, and that's the amount of weight a person can lift for one repetition only. So it's important for you to consider and have a think about why is the 1 rep max not used within the rehabilitation setting. So what reasons might there be for that? Why wouldn't we use it as a rehabilitative process when it's used widely out there in strength and conditioning? This slide shows you in relation to how to calculate your patient's 1 rep max. And then the following slide just gives you some ideas about how to calculate appropriate 1 rep max designing and implementing endurance programs for various different patients. So it might be worth pausing the presentation here and having a go at creating a program for the three patients outlined. So the patron decorator, the postman with the OA knee, and the barmaid following a Colles fracture. Now, what it might be worth doing is having a think about what the basic components of designing a strength program would consist of. So have a look back at the three tasks that you've just done and have a think about what the basic components would be. And if we then go on to outline what the basic components would be, which would be the type of exercise that you're asking your patient to do, whether that's free or body weight, whether you're asking for one single muscle group or multi-muscle groups. Then how does that tie in terms of functional training? And what type of contraction are you asking for the muscle to achieve? Concentric, eccentric? Or are you looking more towards plyometric exercises? How many exercises are you asking them to do? How many sets? How many repetitions? Are you asking them to train 2, 3, 4, 5 times a week? Or are you asking them to train different muscle groups on certain days and other muscle groups on other days? Are you asking for cardio on certain days? Are you asking for weight training on other days? And how much rest period are you giving between exercises to allow the physiological recovery? So it might be worth going back and having a look at the physiological responses to exercise, and then you can sort of start to feed in how physiological responses need the rest periods and how you would then design a program based on that. And then finally, looking at intensity, the amount of force required to achieve the activity. So here you can feed in your 1 rep max, then link these closely to your patient-centered goals. So over the course of the next couple of slides, we'll look at the neural system, body composition, hypertrophy and hyperplasia on a cellular level. So it might be a good idea here to pause the presentation again, have a think about the patient group that you have most of an interest in, and then have a think about an exercise program that you might ask them to do day to day in practice. And then break it right down into what adaptations may occur in the neural system, what happens to tendons, bone density, ligament strength, and then break it right down into a cellular level and have a think about what happens to actin and myosin, what happens to the vascularization in terms of oxygen consumption, and write yourself a flowchart as to what you think happens when you ask a patient to do exercise. So there's just some ideas here on how to sequence your exercise when you are planning a program. So exercise large before small muscles, and perform multi-joint before you do single joint activities. If you're training all your major muscle groups in one session, alternate between upper body and lower body. If you're training body areas on alternate days, change from agonist to antagonist throughout the program. And if you're training individual muscle groups, do higher intensity before lower intensity exercises. So it's just being aware here in relation to progressive overload. So as stress is placed on the body, it adapts to meet that stress. So whenever you're designing a program, you need to make sure that the level of stress placed on the body is altered based on your patient's response to that. So if the level of stress remains the same over the time, the body will adapt to sufficiently deal with the stress that's placed on it. If you overload too quickly, then the body will break down. So therefore, you must train at an intensity which is greater than it normally encounters or greater than it can currently cope with. There are some ways in which to do that. So you can use different resistance training regimes, things like training to failure, pyramid training, eccentric training, forced or assisted repetition training, descending sets, superset training, and increased time under load. Now, what I would like you to do here is just pause the presentation again and just write a sentence or two about each of these headings so that you have an understanding of each different type of overload. And then ultimately, once you have done exercise, you would expect something called delayed onset muscle soreness, or DOMS. And it's generally accepted that DOMS are caused by mechanical stresses on the muscles and the tendons, usually caused by micro tears, causing disarrangement in the sarcomeres. And it's likely to trigger the immune response involving histamines, prostaglandins, and edema, and therefore results in pain. It usually appears between 24 to 48 hours after doing exercise. And there's no evidence at all that the buildup of lactate causes DOMS. So this presentation just outlines the ways in which that you can start to design programs for your patients. This is a very basic level, so I want you to go away and read in further detail, especially around the patient groups that you're most interested in, and especially going into more detail on a cellular level, thinking about actin and myosin, and the muscles themselves and how they contract, and what you're asking a patient to do. Also think about the recovery times that are involved with that, and what actually happens on a cellular level within muscles for that recovery to occur, and how long would we expect recovery to take. So if you can take your patient group and map out from here, so you've already made the exercise program that I've asked you to do earlier on in this presentation. Now I want you to have a think about how long it might take your patient to then recover from the exercise that you've asked them to do and what is happening on a cellular level. So at this point, it might be worth having a think about looking in more depth around the PDF here that I put up. This is a very important paper and one that you can use as a basic level, looking at the different aspects of the body systems that are affected by exercise. And then use that to inform your tasks as you go forward. So looking at task 1, what are the responses to sedentary behaviours, so CVR, metabolic, MSK and neurological systems. Using task 2 to then have a look at the physiological responses to overload. And then finally, your final task is to then post 1 or 2 sentences using patient-friendly terms of how exercise affects the CVR system, the endocrine system, MSK system, and the neurological system. And I'd like you to post all 3 tasks within this Padlet so that everybody can have a look at them and learn from each other as we're doing that. So this video that I've posted here is a really good video looking into when patients say they don't have time to exercise, just breaking down exactly what they're doing within their day. All we're really asking for is half an hour of exercise per day, and it's how we make that as functional as possible and as achievable as possible for our patients. So that's a really good video that you can use as a patient education tool as well. If we look further up at the UK Physical Activity Guidelines, there's some really useful information in here, and there's actually some infographics within here that look at exercise recommendations across different patient groups. So this would be a really good starting point for looking at how to produce patient information, and especially for your assessment for this module. If you do have any questions in relation to this module, or you want to speak to me in relation to anything that's within this folder, if you can again post it down here, I will continue to check in on here. Okay, and I hope you're enjoying this folder.